Hello, everybody. Andrea Majewski here with Dentalelle Tutoring. So I have something exciting to share. I'm actually on the wrong page, so let me just switch over here. But there is now a free quality assurance practice test. So if you are a dental hygienist who is taking the quality assurance exam with the CDHO, you'll be taking that soon. There is now a free practice test. So you can really test your knowledge to see if you're on the right track. Because I've been getting a lot of emails this week, especially because it's that time. And a lot of dental hygienists out there are saying that they haven't taken an exam for 10, even 20 years, and they have been audited, but they would still prefer to take the exam over having to do the whole portfolio. So keep in mind, you do now have that option of you can either take this exam or you can do your professional portfolio. So there's, pros and cons to each. If you're going to take the exam, you have to be able to study for the exam. It's not an easy exam, but in my opinion, it's not super hard either. If you do study for it, you will be able to pass. Every dental hygienist who has taken my quality assurance practice course, which is in the next page that I did have up earlier, they have been able to pass. So that is a great sign. If you study, you will pass. Obviously, if you don't study for the exam, it's going to be harder for you guys to pass because it's not just easy questions like what's perio or what's gingivitis? What do you do if you have a difficult patient? They're not easy questions like that. They are trickier questions that are similar to the board exam, but not the board exam. So don't think, oh, sorry guys, just something popped up. Don't think that you have to study for the board exam for the quality assurance exam. They are completely different, but you do need to study for this exam. So that is why I did make a free practice test. So I will leave the link for you guys on the bottom. There's about 50 questions. And if you do well on the practice test, then that tells you you are on the right track, obviously, and you would hopefully pass. If you don't do well, because it is a trackable practice test. So if you don't do well, you will know right away. You will see, well, which answers did I get wrong? So it will actually show you that. And as I was talking about earlier, if you need help, back over to my other page, I do have the full quality assurance course. So I just kind of wanted to show you guys what that's about. So you have full access to the entire course. Pretty much as soon as you sign up, you will see everything there. So there's PowerPoints, there's mock exams, everything. Even if you're not taking your exam yet, you do have a full 6 months access to the course. So sign up for the course sooner rather than later so you can take your time sort of looking through everything. I have had dental hygienists tell me they have signed up for the course. It took them 2 weeks to study and they were able to pass. But then others said that they wanted to make sure they would pass. It took them 2 months and they were still able to pass. So as I said before, which I think I even put that in here, everyone who has taken my course so far and has told me, because I do not hear from everybody, I do ask everybody who signs up to let me know if they did pass or not, or if I don't hear from them, I do send them an email. But if you didn't pass, I would assume that they would tell me. So I can say that everybody has passed who has let me know. And I do update the course every single time. So they usually update what's going to be on the exam every time they bring out the exam, and they kind of let us know what we should expect to study for it. So this course has been updated. A lot of people ask me if there's any local anesthetic on my practice test and on the course. And yes, there is, because you need to know that for the exam. So I do offer that for you too. And just to kind of show you guys a little bit what's inside here. So it is divided into modules, and then there's a mock exam afterwards. For module 1, it's there's not a mock exam afterwards, because I kind of tied that all in to module 2. So just in case you did not notice that. So you will see all the different topics, and local anesthetic is in here. I'm just trying to think of where I tied it in, because I wanted to keep it down to 7 modules, but you will see everything that you need to know for the exam. I want to say that local anesthetic is in with the medical emergencies and the vitals portion, and there's a little bit in the pharmacology too. But this way, if you sign up now, you can take your time studying, if that makes sense. Now, module 1, as an example, is a shorter module, as you can see here, but it might take you 2 days to study module 1. It might take you 2 hours. Everybody's different. So you don't have to think you have to study a module per day. It's just sort of what you are able to study. It's kind of like taking all of the textbooks, putting them into this course, and it's a lot easier to understand. It's more exciting, and you don't need to know everything like you would have to know for the board exam. So this keeps it much easier. You don't have to think, okay, what do I have to study? I don't know. In this course, it tells you exactly what you have to study. Go through the modules, take the mock exams, and you will have everything that you need to know. There's a large mock exam at the end to make sure that you do know everything. And I am always here too if you guys have any questions. Those who are inside this course can send me an email anytime. But as I said, you guys, try the free practice quiz first. I will leave the link for you guys on the bottom. I believe there's 50 questions for the practice test. I'll leave the link for you on the bottom with the practice quiz, and then also the link for the full course if you would like to sign up. Let me know if you guys have any questions, and thank you so much for listening. I will talk to you guys tomorrow. See you soon.